Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. The feature presentation is on magnesium role in human health. Magnesium is an element which is exceedingly important in maintaining muscle function and also in controlling glucose levels and many other things. So we're going to look at all the things that magnesium can do. What are the symptoms we can look for in patients who have magnesium deficiency, and how much magnesium do we take, and what kind of magnesium do we need to take? So we're going to learn everything about magnesium in this presentation. So let us continue with the feature presentation. Magnesium is a very important element, just like calcium, sodium, and potassium in maintaining muscle function. As you know, we got skeletal muscles and the arterial lumens have muscles. They constrict and they relax. And magnesium is very intricately involved in the muscle function of both the skeletal muscles and also the so-called smooth muscles, which are lining the arterial tubes. In addition to that, magnesium also has an effect on glucose metabolism, which we will learn as we go along, which has a significant role in patients with diabetes. Most of us know when you are having cramps and you tell your doctor, well, doctor, I'm having all these cramps in the night and I can't stand it. And your doctor is going to say, well, maybe get some magnesium over the counter. What kind of magnesium you're going to get? How do you know which magnesium to get? What magnesium does what? So we'll learn about that. As I was telling you, magnesium is very important for maintenance of cellular function. It is involved in the muscle function. It is involved in protein synthesis. It is involved in calcium uptake and glucuronidation. And deficiency of magnesium can lead to a number of conditions such as decreased breakdown of glycogen into glucose. There is increased glucose formation, among insulin deficiency, among many other things. What are the most conditions for which we use magnesium? Magnesium can lower the blood pressure by a tune of 3 to 5 millimeters of systolic blood pressure. Magnesium too has been found to be useful in patients with diabetes mellitus. Patients who have diabetes mellitus have low magnesium levels, and alcohol disorders, because people who drink alcohol, they don't eat well, they don't get any nutrients, minerals, and vitamins. As a result, they can have magnesium deficiency. What are some of the common symptoms of patients who have magnesium deficiency? They can have muscle twitches or tremors. Muscle cramps are the most commonly presenting symptoms. It can also affect your mental function. Patients with magnesium deficiency have been shown to have depression, osteoporosis, that's thinning of the bones, or fatigue. Especially because of the muscle weakness, people feel tired, fatigued, and also it can elevate the blood pressure. It has also been found to have cause irregular heart rhythms. Just like low potassium can cause irregular heart rhythms, magnesium is also known to have irregular heart rhythms. As a cardiologist, we frequently see this, and the first thing we do is we measure their potassium and magnesium levels. If the magnesium levels are low, we give like a gram of magnesium intravenously in the hospital in the intensive care units, whereas in an outpatient setting, you can get tablets which are available in various forms, which I will talk about in a minute. Talking about various forms, here are the different kinds of magnesiums that you can find. Magnesium is also useful in patients with constipation. Magnesium oxide, magnesium citrate, magnesium hydroxide, glycinate, gluconate, chloride, citrate, aspartate. So you got a variety. Basically, you have a magnesium which is tied to another compound to make it readily available for the body to absorb and utilize it. Eventually, it has to be split into magnesium element, which is the one which is involved in the muscle function and in maintenance of glucose levels. Here are the various forms of magnesium that are available. You may want to consult with your physician and see what kind of magnesium do you need. Because when, as a cardiologist, when somebody had low magnesium, we used to prescribe magnesium oxide 250 milligrams twice daily, or like a slow mag, which is like a formula, it's like a proprietary magnesium salt that was generally recommended. But there are various types of magnesium, calcium, magnesium, zinc combination here. Calcium, magnesium, zinc combination here, magnesium and magnesium oxide, magnesium citrate, magnesium gluconate. A physician can recommend what kind of magnesium you really need. And the prices vary. I think the best prices you're going to get are in supermarkets like Walmart or Costco or some other places, but I would do some shopping around and see which magnesium is suitable for you. What is the ideal dosage of magnesium for an adult? That depends upon the age and on the sex. In children, we need 30 milligrams, whereas in an adult 50 plus years, for males, 420 milligrams is the daily recommended dose of magnesium. Whereas in female, it is a little bit less, 320 milligram per day. Constipation is a big problem, especially for the senior citizens. It is a major problem because the first thing when they get up in the morning, their major concern is, can they move their bowels? And those people who are having trouble, we can recommend them to use magnesium hydroxide or magnesium oxide or magnesium citrate, which can help with the bowel movement. As I told you, there is smooth muscle cells lining the gut and also the blood vessels. That's how it helps to relax the blood vessels and improve the blood pressure. In patients with constipation, the magnesium oxide increases the gut motility, which helps to move the stools and helps to improve with the constipation. Diabetes. Patients with diabetes have been shown to have reduced magnesium levels. Giving magnesium levels can improve the insulin action. It improves the levels of insulin, it reduces the insulin resistance, and it helps to control diabetes better. If you are having a low magnesium and diabetes, it makes sense to talk to your physician about getting magnesium, what kind of magnesium supplements you need. Muscle cramps. I already mentioned about these muscle cramps. This is a very common problem. We see this in sports athletes where they are in the middle of their height of their game, they develop muscle cramps, not because, they are deficient in magnesium. It could be related to a multitude of factors like dehydration, sweating, and losing potassium and magnesium at the same time, and those things can have an effect. Magnesium supplements does help to reduce muscle cramps because in my own practice, I have recommended magnesium for patients who develop, especially night cramps. They're sleeping in the bed, all of a sudden they get muscle cramps, their leg is kind of locked up, and it takes 15-20 minutes to get this muscle relaxation back to normal. So think about magnesium if you are having muscle cramps. Depression. In patients with low magnesium, they have been found to have mental depression. But mental depression can be from any number of cases. But when you routinely check a patient with depression, it is good to check their electrolytes, their kidney function, their blood sugar levels, their thyroid levels. Even thyroid can cause depression. Low thyroid can cause depression. So I would say get all these tests done, and if the magnesium is low, then try to supplement it with magnesium oxide like 500 milligrams daily. That might help to minimize some of their symptoms. Magnesium is also involved in a number of other functions, such as enhancing exercise performance. When your muscles function normally, they can contract normally, then your performance is going to be better. As I said, people with low magnesium have muscle weakness, they have fatigue, and that's why supplemental magnesium can improve their exercise performance. Even post-menopausal symptoms like cramps. Again, the cramps are similar to the muscle cramps you get in your legs or in the arms. Then migraine headaches. Migraine headaches are also related to the spasm of the blood vessels in the head, and that makes sense to understand why magnesium. Then people with irregular heart rhythms, if they have low magnesium, they need to take magnesium. Magnesium may have some side effects, but they are extremely rare. If you stick to the dose of 420 milligrams for males, 400 milligrams for men, 320 milligrams for female, there should be no reason for you to have muscle cramps. But as I said, still you need to check with your physician and see what is most appropriate for you, and then you decide what you want to do, what dosages you want to take, and what form you want to take that one. I hope this has been useful to you. You have been watching Triple N Media. I am Dr. Nik Nikam. We have hundreds of videos talking about your health, particularly heart health. Please do subscribe to our channel. Please do watch those videos and recommend them to your friends. And I will see you in the next episode of how to stay healthy and stay away from heart doctors. Thank you so much.